A warm welcome to everyone in today's nursing webinar quiz session. I hope everyone is enjoying the monsoon weather outside and like to be cozy indoor. Myself, Shanti Bhattacharya, the Vice President Nursing, Yashoda Hospital. We are going to play a quiz on orthopedic nursing. To download, I request all the participants to download the Kahoot app and enter your game pin number. You can play in group or play as a single participants. Be ready in selecting your answers and post them as quick as you can. As I've made the questionnaire very simple and hope you all will like it. We are going to run the session on the previous DELT, orthopedic series. They are on the polytrauma assessment and the robotic nursing and the intraoperative of the orthopedic patients. So let me welcome, I think the quiz master doesn't require any introduction. As you all know, she is our very smart, talented and detail-oriented nursing education and training AGM Nursing, who is none other Pratyusha Chaudhary. I welcome you, Pratyusha, and the rest of the session, please take over. Thank you.
Thank you so much, ma'am, for the kind welcome. I'm really happy to join the quiz after a long time. So now we are having so many people joining: Bhumika, Pari, Preeti, Jareen, Srividya, Viju, Samir, Anusha, Archana, Grace. Okay, so for you, let me read out the game pen for you. It is about 9289286. So you just need to open the Kahoot app. If you're not having that, you just need to scan this code, which you can look it on the Facebook page, and then you can scan that and you can join this too. So without delaying much, let me just start this. Before going to this, I wanted to just tell you a few other things which you need to really remember when we are going ahead. So let me start with the few important things which you need to keep in your mind when you're trying to play this game. So the first thing is welcome to the Nursing Pro webinar on orthopedic nursing. And we're really happy to make this series, and welcome to all the participants here. So now the next, I need to tell you some secrets to win this game. So the secrets are: eliminate the wrong answer first. So don't select all the options, just select what is the wrong option first and eliminate all the wrong options, and then you can select the correct option. Select the right option by eliminating the wrong options. Check for multi-selects and double selects in case it is there. And then most vital is, we are not choosing on the whether you are making it right or not, but we are trying to see that whether the fastest finger is on the first term or not. So that decides your scores. So let me start the game first. I think so many people are still joining us. Before that, let me start this one. So we have 4 rounds in this. But the first round talks about robotic advancements in orthopedic nursing. The second round talks about the intraoperative care of ortho patients, and then round 3 talks about completely polytrauma, initial assessment and management. So I think you have got some clue now what we are going to exactly discuss in this show. So now let us go back to the first round. It's about the robotic advancements in orthopedic nursing. I think now everybody are on to your fastest finger first. So let me move on to the next. So now the first question starts in: what is robotic surgery? Your first question asks you about what is robotic surgery. So the options are: option A, using mechanical arms controlled by the surgeon. Option B, perform surgery with programmed. So option C, surgery can done with the help of other robot. Option D, perform surgery with voice assistance. What do you think that the best option would be? So what is robotic surgery? I think many of you are trying to answer still, but select the right answer, eliminate the wrong options. So hence you can see that you are on the top scoreboard. So you have 20 seconds to answer this question. So let me again tell you, what is robotic surgery? What do you mean by that? So is it a mechanical arm which is controlled, or it is a surgery which is helped with a program, or it is just a surgery done by the robot, or perform surgery with voice assistance? You've just got 1 minute and the time is up. Now let me see who is on the top. Okay, so many have went wrong. Oh, still people are only few that who know that it is about the robotic surgery. A is the answer. So now let me show you the scoreboard. Ranga Lakshmi is on the top. Ash, Pramila, Viju, and Nani is on the second top. Okay, just let us go back to the answer, that is using mechanical arms controlled by the surgeon, is nothing but the robotic surgery. Surgery is carried out by using the mechanical arms controlled by the surgeon and bearing surgical instruments with using a camera. So it's a minute camera which we are going to use in the robotic surgeries. That's about the first question. So again, the fastest finger first. So let us go back to the second question. So the question asks you about what is the use of robotic in orthopedic surgeries. So let me ask you again, what is the use of robotic in orthopedic surgery? So the options are option A, to make the precise movements. Option B, not required to stay in hospital more days. Option C, surgical robotics are becoming pervasive. And option D, for using advanced technology. What do you think that why we use robotics in orthopedic surgery? So which option is the best one? You have got 20 seconds to answer this question. And most of you are again answering the same. So here option A, B, C, and D. Again, those who are joining, you have the game pin down. Those who are just joining now, so it is 92899286. Please do join and answer. I have got almost 4950 answers. We have got just 5 seconds to answer this second question. Who is on the fastest finger first again? So now the time is up. Let me see who is trying to tell answers rightly. So our answer is A. I think only 11 people have got it right. So again, on the top, oh my God. So now Nani is on the top. So from the down, he has just surged up. So now we have got 6 places again. Pravalika, Siri, and Vara is on the top. So let me go back to the rationale why we have the answer. The answer is about to make the precise movements why we do use in the orthopedic surgeries. It allows us to have the high precision. That is nothing but the programming, and the quality outcomes will be higher if we do use this in the orthopedic surgeries. That's the answer. Let us go back to the next question. Again, the fastest finger first. So we have double points for this. Make sure the fingers crossed, and you have to make sure that the answer will be correct. So again, how does the surgeon controls the robot? So this is about the third question. How does the surgeon controls the robot? What is the use? So the options are option A, through the laparoscopic, and option B, through console, option C, with the machine, option D, any other device. I think I'm just going to give you again a clue. So you just need to understand a different terminology. If you understand what is laparoscopic, what is machine, what are the other devices, what is console, I hope you will definitely answer for this question. Hope, yes. So I think we got 50 answers and still people are answering. I think few are still thinking what should be the answer. So this is a very simple question. How does a surgeon control the robot? What do they use? Do they use any kind of devices, laparoscopy or a machine? So what is your best answer? So those who are seeing this on the Facebook can also answer on the Facebook. Wonderful. And the answer is through console. Yes. How many people have answered it correctly? So 26. Wonderful. Great. So now we have again a scoreboard. Oh my God. Nani went off and Siri SMJ is on the top. Pravalika is again gaining the second, and Sneha Sabu is on the last 5th role. So again, a fastest finger first. Before that, I'm just going to tell you the rationale about the third. So it is about through console, they're going to control the robotics. So surgeons' hands and wrist movements are exactly replicated by the tip of the wrist on the robotic arm, like console. So you can see this in the picture. So it's a console where they are going to operate just like a machine, right? So again, the last question for this one, again, it has got double points for this. So what challenges are faced by nurses in the robotic surgeries? I think most of the things we need to understand when we are trying to answer this question. Just keep in mind what are the challenges are faced by the nurses and the robotic surgeries. So the options are option A, development of new competencies. Option B, patient safety regarding robotic surgery. Option C, team building. Option D is all of the above. What do you think that most of the challenges will be faced by the nurses and the robotic surgeries. We have got 55 are answering. Still, people are answering more. Great, doing good job. So what are the most challenging things that we do have in the nursing for doing this robotic surgeries? While we are assisting, what do you think that the most challenging things are? We have just got 5 more seconds to answer this question. What do you think? A, B, C, D is your answer. So most of the people are answering. Yes, 74 have answered this question. Yes, all of the above. Yes, most of them have answered. 55 has answered it correctly. Congratulations. Let me see who is on the top score. Wow. Again, Siri SMJ is on the top score, and Nani and Seema and Chinu were on the last rows. Now let me tell you what is the answer. All of the above, as we told, there are the developments of new competencies, team building, and patient safety regarding the robotic surgeries are the main challenging things that the nurses will face, because they need to definitely develop the competency and skill that they need to acquire when they are trying to assess the robotic surgeries for the surgeons. Yes, again, we are done with the first round. We are going ahead with the second round. We have got intra-operative care of orthopedic patients. Just keep in mind when you are trying to answer, we are only talking about the intra-operative care of orthopedic patients. So just let me allow to go for the first question. So here is your first question. Which action best describes scrub nurse who maintains the aseptic technique during the surgery? Which action best describes a scrub nurse who maintains the aseptic technique during the surgery? The options are option A, disposable waterproof shoe covers. Option B, wear personal protective equipment. Option C, insist that all operating room staff perform a surgical scrub. Option D, change the glove after touching the upper arm of the surgeon arm. What do you think that the answer would be? You have got a time limit again, so you need to answer faster. So, I have got only 10 right for this question. I think I have to remind you about the rationale here. Okay, the scoreboard again remains the same. Siri is on the top and Nani is scoring the second scoreboard. So the option is D, as a change the glove after touching the upper arm of the surgeon arm, because the sleeves of a sterile surgical gown are considered sterile only 2 inches above the elbows. So touching the surgeon's upper arm would contaminate the nurse's gloves. That's why we should always go for this. After touching this, we should always see that the gloves needs to be changed. So let us go for the next question. Again, the fastest finger first. So the question is, in the WHO surgical checklist, the period after induction and before surgical incision is termed as what? So according to the WHO surgical safety checklist, we have got that. So after the induction and before surgical incision, what is the time period will be termed as? So we have got the options called option A, sign in, option B, sign out, option C, time out, option D is time in. So I'm getting super good answers here. 70, 71, 74. Great. Oh, 80. Yes. So the option is, oh my God, again, 15 only have answered this correctly. So it is time out. Yes. After the induction and before surgical incision, it is termed as time out. Let me tell you the scoreboard. Again, Siri SMJ is on the top. Nani, Lali, and RP is on the next coming up scoreboard. So let me show you the answer, the timeout. The timeout, each team member will introduce him or herself by the name and the specific role. That's why it is called as timeout. So let's go for the next question. It again have the double points. So make sure you will definitely score higher to change your scoreboard. What is the highest priority of a nurse in care of surgical patients? What do you think that the best answer would be? What is the highest priority of a nurse in care of surgical patients? The option A is monitoring a patient's condition. Option B, to help answer the questions. Option C is nursing documentation. Option D is all of the above. What do you think that the best answer would be? So here they're asking you for the highest priority of a nurse. So 85 have answered it. So in this, only 30 have answered it correctly. Monitoring a patient's condition. Yes, it's correct. So now let me show you the scoreboard. Great. Again, Siri SMJ is on the top score. And Kotakonda Lata is on the second. Lali, Seema, and Ash is again firing up for the first place. Great. So let us go for the rationale here. Answer is A, monitoring a patient's condition. Hemodynamic monitoring is very important and vital while taking care of surgical patients. So that's why important thing is the most priority is always monitoring a patient's condition, hemodynamically stable or not, that we have to observe. So let me go for the next question again. So here we have got the double points. So let me tell you, the question is completion of sponge and instrument counts and labeling of any surgical specimen obtained during which period? Again, I'll repeat the question for you. Completion of sponge and instrument counts and labeling of any surgical specimens obtained during which period? Option A, sign out. Option B, time out. Option C, time in. Option D is sign in. So what do you think that the best answer would be? So here we are having almost 85, 86 people have answered it. Oh, 90. So we didn't reach the century, but still 90. So yes, 37 people have answered it correctly. It is sign out. So let me show you the scoreboard first. Siri SMJ is on the top. Seema, Lali, Kondalata, and Ash is on the next scoreboard. So let me tell you the answer. Answer is A, sign out. For sign out, a team will review together the surgery that is performed, and completion of sponges and instrument counts is mandate before we sign out the procedure. That's really vital. So let us go back to the next one. So this is about the round 3. So I hope your scoreboards are going higher and higher. This is the last round which we are going to decide whether you are on the top score or not. Yes, the round 3 is talking about the polytrauma initial assessment and the management. So let us go back to the first question. The question talks about management of patient with the polytrauma includes what? Management of patient with polytrauma includes what? Which of the following? So option A, assessment of polytrauma patient by the surgeon. Option B, preparation of treatment plan. Option C, preparation of treatment plan. Option D, ultimate responsibility of the patient for the treatment and discharge. So, and the final option is all of the above. What do you think that is the best answer? 29 people have answered it wrong. 6, okay, 45 people have answered it correctly. Wonderful. Let me tell you the scoreboard first. Okay, Siri again on top. Very good. Please do maintain the same thing. Seema is in the second top. Lata is in the second top, third. Lali and RP is on the next scoreboard. So let me tell you the rationale. All of the above is the answer because we have to treat the polytrauma patients with all the parameters which we have discussed during the options. So let us go back to the next question. Yes, here's the question. Which generation predominantly the primary victims of polytrauma are? Which generation predominantly will have the primary victims of polytrauma? Which generation? Okay. So adulthood, option A is adulthood. Option B is younger generation. Option C is older generation. Option D is children. What do you think that the best answer would be? Which generation do you think will be more prominently getting this polytrauma? So we are getting most of the answers. So let me see who will answer it correctly. Okay, 43 people are into the younger generation. Wonderful, great. Those who are into older, adult, and children are really wrong. Yes, we know that younger generation are the most of the people who will get into the trouble, right? So Siri again on the top, Seema, Lata, Lali, and RP is not giving anybody chance to score on the top. Great. So the answer is answer B. Option B is the answer, younger generation, as I said you, because males are predominantly, and see this again, males are on the top to have this polytrauma injury most oftenly, right? Because most notorious one, yes? So let us go back to the last before question. So we have double points for this. Please do keep it in your mind and then see the question. Polytrauma score takes into consideration all of the following physiological criteria, except. So keep in mind all of the following, but except what? So now the options are option A, Glasgow Coma Scale, option B, respiratory rate, option C, capillary refill, option D is blood pressure. So what do you think that the best option would be? So we are getting so many answers here, but still you have got just 4 seconds to answer this question. Again, faster. Yes. So we have got 89 answers in this. Capillary refill is the exceptional criteria, as you said correctly. Great. So now the scoreboard again. Yes, Siri again scoring on the top, and Lata again scored the second. RP gained the third position. Rangalakshmi again onto the scoreboard 4. Subita is again onto the top one. Okay. So the answer is C, that is capillary refill. Commonly assessed parameters are Glasgow Coma scale, systolic blood pressure, and respiratory rates as per the revised trauma score protocols. But not in this list, the capillary refill is not even as a prioritized one. So the answer is not capillary refill, right? So now the last question for this quiz. I hope we have come into the end of this, but still make sure that you are on the fastest finger first. The question is asking you about what kind of trauma causes internal bleeding. What kind of trauma causes internal bleeding? So, okay, just check with these answers. Options like option A, blunt trauma, option B, acute trauma, option C, chronic trauma, option D is complex trauma. So what do you think that the best answer would be? You have just got 2 seconds to answer this question. Come on, fastest finger first. Again, I'm just seeing who's on the top. Okay, so 51% people have answered it correctly. It's about the blunt trauma. Okay, let me see the answer. Yep, only this answer will get the ration at the top first. So answer is about the blunt trauma, because blunt trauma, this is the injury of the body by the forceful impact. So it is the most common cause of vascular injuries and can cause internal bleeding. So the answer is blunt trauma. So how many of you are really waiting for just checking with the scoreboards? So let me show you that. Okay, before that, I have just an announcement. Congratulations to the winner first, and join us every Thursday Facebook Live at 3 p.m. for more and more exciting webinars and quizzes. If you're there first time on our Facebook page, so please do follow us every time. Every Thursday, we are doing this webinars at 3 p.m. sharp. You can join us. We are having different series, which is being proposed from Shanti Ma'am's side. So please do take a selfie in case if you're joining us with your groups, and please do hashtag with Yashoda Hospitals Nursing Education and Training webinars on your social media and keep it more interesting like this. Wonderful job, everyone. So now let me show you the scoreboard. So who's on the top? So the nursing pro quiz, orthopedic nursing, on the top 3 is RP, top 2nd is Kottakonda Lata, and I think none other than, all of us know that. Yes, this is about Siri SMJ is on the top. Wonderful, everyone. Thank you so much. And thank you, Rangalakshmi and Subita, you are on the top. So wonderful joining all of you. You have played really, really well. I hope you also can join the rest of the webinars every Thursday at 3 p.m. Thank you so much, Shanti ma'am, for giving us a beautiful quiz. And I think, ma'am, you have drafted it so wisely, but it's so easy to also answer. Thank you so much, ma'am, for me to take this opportunity to explore this. Thank you so much.
Pratyusha, I think being as a very silent spectator, I was just enjoying the session, and I could see the attitude and skill of our nurses. Very correctly they have selected the questions, and they have also allowed us to give the area of room where we are supposed to again retrain them. Let's say robotics, they were a little going gradual drop, and then other areas they have done very well. And thank you that you have coordinated very well, being as my the excellent host. And
thank you so much.
Thank you, everyone. Stay connected until Thursday next week. And this Thursday, we are going to again bring the endovascular series for you guys. Stay safe as monsoon showers are being experienced by everyone. We don't want you all to just take the over-the-counter medications. Consult your doctor in case you have any kinds of respiratory illness. Thank you so much. Thanks, everyone. Thank you, Pawan, the branding and the digital team. I must always thank him, though he's overwhelmed with a lot of other schedules. And the brain behind this webinar is none other our Yashoda Monarch, who is Dr. Pawan. Thank you so much, sir, and everybody else. Stay connected. Thank you.
Thank you so much, ma'am. Bye.